Hello everyone, today we are going to talk about forehead lift. Do you suffer from wrinkles on the front of the head? Do you want to get a bright and beautiful young face? Well, this video suits you very much. A forehead lift is also known as brow lift. It's a cosmetic surgical procedure to tighten sagging forehead skin and raise the eyebrows. A forehead lift can also reduce the appearance of wrinkles on the forehead and between the eyes. After watching this video, you'll know all about this facial plastic surgery, when it is resolved to, and the expected result after the operation. Our role today is to answer most of your questions regarding forehead lift. Today we have Dr. Han, who is a leading doctor at Lara Plastic Surgery. He is going to discuss with us everything about forehead lift from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so next time you'll be updated with our new releases. Hello, Dr. Han, how are you?
How are you?
Can you introduce yourself to our audience?
Hello, I am Han Sang-chul, a plastic surgeon, representative director of Lara Plastic Surgery. I am mainly in charge of forehead lift at Lara Plastic Surgery Clinic, and I mainly do endoscopic surgery, including forehead lift.
So doctor, for our first question, is sub-brow lift and forehead lift the same procedure?
The lower eyebrow and forehead lift both have one common purpose, which is surgery to grow the eyes without changing the eyebrows around the eyes. So the purpose is the same. But the lower eyebrow lift is a method of raising the eyes by making an incision in the skin under the eyebrows. In the case of forehead lift, it is a surgery to make the eyes bigger by pulling the skin around the eyes from the forehead to the eyebrows. These are the two surgeries that are performed for the purpose of increasing the eyes without changing the eyebrows, but there is a significant difference. The eyebrow lift is usually performed when the distance between the eyebrows and the eyes is very far. So there's a lot of space and the sagging skin is thick. In the case of forehead lift, the distance between the eyebrows and the eyes is rather close. But when you have sagging skin, or when your eyes are small, you can think of it as a surgery to increase the distance between the eyebrows and the eyes while increasing the eye size.
So which type of forehead lift do you usually perform?
Generally, forehead lifts can be divided into three types. Endoscopic forehead lift using an endoscope, which I mainly do, and hairline incision forehead lift that can be done while reducing the forehead when the length of the forehead is wide. And the traditional method of the past, coronal incision, which was often done when there was no endoscope, and coronal incision forehead elevation, which cuts the entire hairline. So there are these three types. Among those three surgeries, I do the most endoscopic forehead lift for the purpose of having the smallest incision and quick recovery.
Okay, so can you briefly explain the difference between those techniques that you have mentioned?
First, the hairline incision forehead lift is the most effective way to do a forehead lift while reducing the forehead for people with very wide foreheads. So if you have a long forehead and want to have a forehead lift, you would choose a hairline incision forehead lift. And in fact, coronal incision forehead lift is not done much now because of the scarring. But you can think of it as a traditional method. When the length of the forehead is very narrow, it is sometimes used as a way to perform a forehead lift while extending the forehead. And the third one I mentioned earlier is the endoscopic forehead lift. Although the forehead cannot be reduced like the hairline incision forehead lift, the length of the forehead length is minimized and the surgery is performed while viewing the endoscope. So the surgery is as effective and can produce the same result. And since the endoscope is used instead, the total incision line does not exceed 3 centimeters, even if the entire incision line is combined. Therefore, the recovery is very fast, so the return to daily life is fast, and there is a very big advantage of not having much swelling. So I mainly suggest endoscopic forehead lift.
So I've heard that people in 20s to 30s that are not a good candidate for a forehead lift. So is it true and why?
The fact that you shouldn't do a forehead lift when you're young may differ depending on your point of view. But if you really want to do a forehead lift for the purpose of removing wrinkles on your forehead, in fact, young people may not need a forehead lift at all. But as I said at the beginning, forehead lift is not an operation that only removes wrinkles on the forehead, but actually enlarges the eyes by pulling the skin between the eyebrows and the eyes, and eventually the eyelids. So among young people, when the distance between the eyebrows and the eyes is very close, causing the eyes to look stuffy, it is the most suitable surgery for those who want to enlarge their eyes but do not want to have their eyes incised. So if young people need an endoscopic forehead lift, they should do it. But of course, it should never be done on someone who doesn't need it.
So is it going to change the hairline height and the shape after having a forehead lift procedure?
Usually in the case of an endoscopic forehead lift, 4 incision lines are used, such as a vertical line towards the scalp, 1 to 1.5 centimeters, and 2, 0.5 centimeters from the temple side on both sides. In fact, since the incision line itself is so small, it can be seen that the length of the forehead going backwards is short. However, as I said below, it is unavoidable to widen the forehead to some extent because it is actually pulling up between the eyebrows and the eyes and pulling it up from the forehead side. Usually you can think that the forehead gets longer by about 2 to 5 millimeters. Although the length becomes longer, the distance between the eyes and the eyebrows can make your eyes pop more, and even the wrinkles on the forehead can be straightened. So if you see it being that effective, this surgery would be necessary.
So do people with a long forehead able to get a forehead lift?
I mentioned that the forehead is inevitable, widened when the forehead is lifted. I think it is wrong not to choose a forehead lift simply because of the gap that is around 2 millimeters to 5 millimeters that widens the forehead. Instead, initially from the beginning of the hairline to between the eyebrows, from the eyebrows to the tip of the nose, and from the tip of the nose to the tip of the chin. For all this, the most ideal ratio is 1 by 1 by 1. However, if we look in the mirror, and our forehead is much longer than the 1 by 1 by 1 ratio. In fact, if we do a forehead lift, the forehead will be elongated, so the ratio will be broken, causing us to look older. In this case, you can choose a hairline incision forehead lift, or a method of forehead reduction and forehead lift together. During forehead reduction surgery, the forehead is reduced by about 2 centimeters, and if the forehead is raised while performing a forehead lift, the forehead can be reduced with 1 incision line as well as a forehead lift, so a more dramatic effect can be seen.
So are there any procedure that the patient can get together while they're getting a forehead lift?
As it is mainly performed on the forehead, as I said before, one of the most accompanying surgeries is forehead reduction. I choose it the most because it can really change the impression of the upper face as it can be raised while shortening the length of the forehead. As for the surgery that can be done together, I said that the basic purpose of the surgery is to enlarge the eyes rather than to straighten the wrinkles on the forehead, right? So any surgery that can make your eyes more beautiful while growing them is possible at the same time. So if you are making double eyelids by burying method of making double eyelids by incision, or if you are pulling eyebrows from the forehead side while doing eye augmentation surgery, such as front, rear, and lower eyelids to grow your eyes, you can get vertically grown eyes with a forehead lift, and horizontally raised eyes can be obtained with front slits or back slits. That way, most eye-related surgeries can be performed simultaneously.
So is it possible to correct eyebrow symmetry with a forehead lift?
In fact, there are a lot of people who come to the hospital for eyebrow asymmetry. If one side of the eyebrows are down and one side is raised, in fact, a forehead lift is often performed for this purpose. When the eyebrows are asymmetrical, it is possible to correct the asymmetry by raising the eyebrows on one side and raising the eyebrows naturally on the other side according to it. We call it a sciatic muscle resection, but there is a muscle that pulls the eyebrows down strongly when you frown like this, right? Usually, if this muscle is very strong, only one side is strong, or if only one eyebrow is used a lot. In that case, there will be a lot of eyebrow asymmetry. In that case, it can be corrected by loosening one side more by exercising the corrugator muscle, since you can even correct the direction and shape of the eyebrow position by using corticosteroid resection. You can think of it as correcting the shape of the eyebrows, the asymmetry of the eyebrows, and the position of the eyebrows with a forehead lift.
Okay, so are there any procedure that the patient should avoid while planning for a forehead lift?
Forehead elevation is actually a surgery that changes the position between the forehead, eyebrows, and eyes. That is why it is not necessary to receive it before surgery. But if fillers or fat grafting are done on the forehead right before surgery, the shape of the forehead that I made beautiful may eventually change to an unwanted volume for position change. Therefore, it is recommended to avoid surgery that fills the forehead with volume right before surgery, such as forehead fat grafting or fillers.
So how long does recovery take after the procedure?
The recovery period may vary depending on the method of forehead lift, but for hairline incision forehead lift or coronal incision forehead lift, the recovery is inevitable, long before the incision is long. However, if you think about the endoscopic forehead lift, which I mainly do, a recovery period of about a week is sufficient. It can be seen that there is no problem in daily life except for avoiding washing your hair to protect the incision for 2 to 3 days immediately after surgery. In fact, since there are no seams or incisions on the face part that you see right after the surgery, and this part, the part people can see, there are no incisions, so it can be seen that daily life is possible right after the surgery. And once the stitches are removed, after about a week, you can think of it as a surgery that recovers quickly enough that there is no need to visit the hospital afterwards.
So is it true that forehead lift is a procedure that a person can only receive once in their life?
All lift surgeries will be the same. In fact, there is no such thing as once in a lifetime, because it is a surgery where the sagging part or the loose part is pulled up. If we say that you did it in your 20s or 30s, as it was necessary, and if you are now naturally aging in your 40s or 50s, and aging progresses as you get older, you may need another forehead lift. Most of the people who underwent a forehead lift at a young age have had narrow eyebrows and a narrow space between their eyes before surgery. So if you increase the narrowness later when you get older, there are more cases where you need lower eyebrow lift or upper eyelid surgery rather than forehead lift. But anyway, it's not a surgery that can't be done again once you've had it. Anti-aging surgery is all like this, but if there are some changes as you get older, you can correct the shape by adding enough endoscopic forehead lift. Or when you are older, you can solve it in other ways with a hairline incision or a coronal incision forehead lift.
So are there any side effects for this procedure?
I know that in the past, when there was no endoscope, there was a lot of blind surgeries. But I know that there were a lot of big side effects, such as nerve side effects and vascular side effects at that time, as stated in textbooks. In fact, now that the full HD endoscope is used, the location of nerves and blood vessels can be seen very clearly, so there are virtually no major side effects that can occur from any surgery. The most common side effect is that when the forehead is pulled so strongly, the nerve is also pulled. We call this traction. Because the nerve is also pulled, there may be a side effect of slowing the sensation back to the forehead, scalp, and here for about a month to 3 months. And as with all surgeries that cut the hairline, there may be side effects such as temporary hair loss and hair loss at the spot where the scalp is incised. However, the neurological symptoms or hair loss I mention now are not a permanent side effect. But if it lasts for a while, you can think of it as a temporary side effect that can be fully recovered for 1 to 3 months.
And so for our last question, how long does a forehead lift effect last?
Anti-aging surgery has a certain maintenance period. This is a bit difficult to explain, but ultimately, as you age, new changes will occur. And the effect of the part where you had a forehead lift on the change will be less. Usually, if you perform surgery in your 20s and 30s, it will be maintained until you are in your 40s and 50s. And if you do surgery in your 40s or 50s, if you do it without other surgeries, you will see a certain rate of aging. This downward phenomenon may occur in around 10 years or so. So I usually think of it as about 10 to 15 years. But this is probably an individual difference. As I said before, anti-aging surgery usually involves pulling the wrinkles between your eyebrows and eyes, or forehead while stretching them. So person A, whose eyebrows are close to the eyes, changes to person B, whose eyebrows and eyes are further apart. So it is not like it suddenly changes or falls apart after a certain period of time. Usually you have to bandage until the next day after surgery. So you need a bandage and disinfection for a day or so. In fact, since the incision line or wound visible outside is not large, it is hardly a problem to stay for a day or two and leave the country 3 days after surgery. Of course, when you leave the country, you will have to pull stitches locally. But anyway, traveling by plane is no big deal after 3 days after surgery.
네, 감사합니다.
Thank you.
Today we learned many things about the lifting procedure, and the doctor explained in details everything related to forehead lift, such as its indication and expected results. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.